Okay, we're live in Fort Myers, Florida. I am Dr. Scott Geller, laser floater. I think I'm an expert at this point. 20
Certainly.
20,000 laser sessions. I'm getting old at this, I guess, but I still love doing it. I've got a great patient here from South Jersey, basically, isn't it?
Yes.
My old stomping grounds when I grew up in Philadelphia. And you had an interesting situation. You had a posterior vitreous detachment in the left eye and a Highland opacity. It wasn't exactly a white ring. It was more or less a solid object, looked like a bug. And we did it yesterday, and tell me, it's pretty much gone now?
It is gone. It's 100% improved. I'm very satisfied with the results. I'm glad I came here. Glad I came to Dr.
I,
Scott Geller.
I'm glad you did too. I always tell patients more is not always better in this area. A lot of guys who jump into this just don't know that, and they randomly shoot things, but that changes the dynamic, and you could take two steps forward and one step backwards. But you had one of my colleagues, we don't have to talk about who it was, uh, do laser on your right eye. How many years
No,
ago?
you did my right. He did the
Oh,
left.
excuse me. I did your right, and he did the left.
Yes.
How many years ago was
About a
that?
year and a half.
Year
About a
and a
year and a
half.
half ago.
But that required how many sessions?
That required three
Three
sessions.
sessions, yeah.
Yes.
Ultimately, he got it.
Yes.
So you're satisfied with that result. But he uses a different laser. I use the Ultra Lazog made in Switzerland laser, which I consider the best. I've used all the others. And I think the results speak for themselves.
Yeah, absolutely. And one of the main reasons I came all the way to Florida was to have this done by Dr. Scott Geller.
Oh, you're so sweet.
Yes,
You're
for sure.
so
That's
sweet.
one of yeah.
And we love doing this. I really enjoy it. I do something I think other doctors sweep under the rug. Didn't you go to an
Oh, I
ophthalmologist that
did.
said don't do this?
I did. I've been to numerous ophthalmologists where I live, and everyone said there's nothing that can be done. You have to just live with it. You'll get used to it. However, you can't get used to something floating in front of your eye 24/7 and very annoying and very distracting. So I needed relief and I got it. And hopefully this is it. Hopefully I don't need any more treatments or doesn't come back.
Well, that won't come back, that's for sure.
Yeah.
And more is not better. There's always something to see when you have a posterior vitreous separation. And sometimes you have to educate a patient that, I can't turn the clock back to when we were 25, unfortunately,
Yes.
but we can make life better. Anyway, you're a great patient. It's mid-February to 2020, and enjoy your time down here in Florida.
My thank yous. Thank you so much.